So the employee has failed the first line indicative drug test. We now need to send samples of oral fluid off to the laboratory for a second line chain of custody test. So we know that the employee has failed on here for cannabis and opioids. So that's what we're going to be asking the laboratory to test for when we fill out the consent form. Put that to one side. So I've got my gloves on, I've got absorbent material. Let me show you the components of the kit. So first of all, we have a track 24 envelope, which we're going to put the samples in to send off to the lab, so I can put that to one side. We've got the consent form itself, which we're going to fill out, and I've done a separate video to show you how to complete the consent form for lab tests, so we'll put that to one side as well at the moment. We've got a plastic box, which is where the samples are going to go once we've put them into the vials. So let's put that to one side now. We've also got a transit bag. This is in two parts, a back part and a front part. There needs to be separation between the samples and the form when you send them back to the lab, so that's why there's two parts to that. I'll show you that in a little while. And we've also got two bags here. In one side of each of the bags we have a vial which clearly has the expiry date marked on it, so please don't use out-of-date kits. I'll take those two out first. And in the other side of the bag we have the collection devices themselves. So I'll take these out. So they're the collection devices. And I'm not so sure whether you'll be able to see this or not on screen, but at the bottom there there's a little window, and at the moment that's white. So what I would ask the employee to do is put these both in their mouth. They'll stay in their mouth, they'll be moved around the tongue, so 30 seconds on the top of the tongue, 30 seconds on the underside of the tongue. So we move it around the mouth, and what we're looking for is for that little window to turn blue. Once that turned blue, I would take one out of the mouth, prepare it to send to the laboratory while I leave the other one in the mouth. And then once I've finished the first one, I would then take the second one out. So this is how they should look when they've been in the employee's mouth. That little window that says now turn blue. So I would take one out and prepare that to send off to the laboratory. So we take one of the vials and we open the cap. And we simply put the pad and the handle, the whole thing, into the vial. So that goes there, and now we do the same with the second one. So they're now in the vials in the buffer solution, ready to go off to the lab, and we come back to the form. And so what we did when we went through the form, we got the donor or employee to initial and date the two anti-tamper seals at the bottom, one marked A and one marked B. So let me show the easiest way to do this. So I'm going to take the bottom one. It's easiest to do it that way round. So I take the bottom one, peel that off until the letter just comes off the form. I then take the vial and I lay that flat onto the bottom of the form there, and I simply lay the anti-tamper seal down on that side. I then peel that off like that. The other way of doing it, which is going to be slightly trickier, is if I just simply peel the thing off like this. What you'll find now is very often it'll coil up again, against itself. And you then got to try and unstick it, and what you don't want to do is get any tears or rips in these things before they go off to the lab. So the easiest way to do it is the one I did for the first one, but we've now got this one here, which is the letter A. So you should have the letter, let's push that down properly. You should have the letter A and B on the tops of the caps. There can't be any suggestion that these have been opened after the employees left the room. And the samples have been tampered with, and that's why there can't be any tears or rips. So they now go over the tops of the caps. We come back to the little plastic tray that I showed you earlier, and we're simply going to take these and we're going to push these into the little slots in the tray, being careful not to put rips or tears in the seals. So they go in there, and then we close the lid. And what I do is we have 4 barcodes at the top. I take one of those barcodes and I place that onto the back of the little tray. When the laboratory receive the samples, they will scan that barcode. It will tell them that the kit has been bought from us and sold to you, so that ties us all in together, and the laboratory know who the result has got to come back to. So that goes into there. I now take my transit bag. Remember, I mentioned this earlier on, that has 2 parts, and I put the samples in the front part of the transit bag. And now I also take another barcode off the top here, and I simply put one of the barcodes onto the outside of the bag. The form at the bottom will tell you where each of the copies has to go. So the white copy is the laboratory copy, so this is going to get returned to the lab along with the samples. I always give this to my kill assessor and ask them to check to make sure it's all been signed and dated in the right place. We have provided you with an image of or a booklet that includes a completed consent form, so that will tell you exactly what it should look like when it's completed correctly. So I now place the consent form for the lab into the back part of the transit bag, so there's now a separation between the samples and the form. Peel the little white seal off the top there, push that down. You now have to physically break into the bag to get into it. Come back to our postage bag, and we're going to slip that into there. Take the seal off the top of the bag, seal that down. That's now ready to go off to the lab. So you're going to put that in a normal post box. That's a Track 24 envelope. The pink copy is the employee's copy. They have to have a record of everything that's happened as far as this test is concerned. And they may say to you that they want to get their own sample tested. First of all, they'll need to find a laboratory willing to do an independent test. That test is probably going to cost them somewhere between £200 and £300, which they'll normally have to pay for up front. Once they've found a lab who's happy to test their sample, they'll need to put in an email to you, which you then send to us, requesting that the sample is tested at an independent lab. So what will happen when the laboratory receive the 2 samples? They will test the A sample and they will keep the B sample in storage for 18 months. So this is the sample that the laboratory will release to an independent laboratory of the employee's choice. And all the details of the lab, the address and phone number is on the bottom there. So you give them the pink copy, the blue copy and the green copy. The blue copy is the collector's copy and the green copy is the employer's copy. I don't see any reason why you probably want to separate these, and what I do is I staple the initial test consent form, the one that we completed when we did our first line indicative test. I staple that to these and I send that off to the HR department, and that is how to conduct a second line oral fluid chain of custody test and send it off to the Matrix Diagnostics Laboratory. Thank you.